Sounds like there's a few people coming on, but good morning, everyone. My name is Caroline Rossing, and I am the grant coordinator for the Wisconsin Statewide Parent Educator Initiative. And I want to welcome all of you here today to this webinar. Today's webinar, we hope that you will learn from these numerous organizations in Wisconsin about the many ways that they support individuals with disabilities and their families. The Wisconsin Statewide Parent Educator Initiative is organized and is hosting this webinar today. We hope that you find this webinar information beneficial, and we thank you for attending today. I would like to share some logistics with you, and then we can begin. So we're going to be moving quickly today. We have 10-minute presentations from 12 organizations. We also have a question and answer period after each presenter. We're estimating about 2 to 3 minutes, but we may have a little more time than that. So please think of any questions that you'd like to ask, because we want to be able to take the opportunity when the presenters are on with us to ask those questions. And the way we're going to take those questions is if you would please enter those questions in the chat today on the Zoom connection. And then any of those questions that are in the chat, we would like you to put them in there during the time the presenter is presenting, or during that 2 to 3 minute time frame after, when we are doing the answer and question session. We will not have the opportunity to ask those questions of the presenters after that allotted 15-minute time frame. So if you have questions, please get them in. But also know that anytime after the webinar today, you can contact any of the presenters today with questions, or you can contact WSPEI also with any additional questions. You will also not be taking any breaks. So take care of yourselves, do what you need to do, but because of the fact we have so many organizations presenting today, our time is really tight, so we're just going to continue to move through. There may be some small opportunities. If we don't have a lot of questions for a certain presenter, we may have a little, a couple minute time lapse there that we can take a really short break, or that would be a good time to slip away and do anything that you need to. Also, all the audience members will be muted throughout the webinar. Another feature that we're going to be using today is a caption feature on Google Slides. So as you see you will be seeing the presenter's words running across the bottom of the screen as they are speaking. Also, after the webinar, we'll be sending an evaluation to you. So you'll receive an email from WSPEI Statewide following this webinar, and we would really appreciate you completing this evaluation in order to give us information so that we can better develop future webinars. I'd also like to thank Sherry Silla, our CISA 1 WSPEI coordinator, and Evelyn Asbell, our CISA 9 and CISA 8 WSPEI coordinator, for assisting with this webinar today. So with that, we can get started. Start with our introductory slide here again. Learn from agencies and organizations about how they support families and students in the areas of special education and self-determination.
Hi,
oh, go ahead. I'm sorry. So our first
That's fine.
Today, is Sally Flasberger. Sally is a lead advocacy specialist for Disability Rights Wisconsin. So thank you for presenting today, Sally, and you may begin when you are ready.
Okay, great. Thank you very much. I'm glad to be with everyone today. So I work for Disability Rights Wisconsin. I'm a lead special education advocate in our Milwaukee office. So I'm just going to provide some information about our services around the state. So I just wanted to start off by just telling you a little bit about disability rights. As you can see, I have posted our vision and mission statements, and really the crux of it is that we support people with disabilities from 0 to death I guess I would say, and really to allow people to be included in their communities and live the life that they want within their communities. And really, we do this by um, challenging systems, working with people individually, whether it's kids or adults. Obviously, my focus is in special education, and I do a lot of work with kids around waiver services and those things also. So we are what's called a protection and advocacy organization. So every state has a PNA, that's how we refer to ourselves, that provide advocacy and legal services for people with disabilities. So any types of rights violations that someone might experience, they would come to a protection and advocacy agency for that. I will say that one of the most calls we get is around special education and in all of our offices. We also hold several state contracts. One of those that kind of intersects with kids is often the Family Care and Iris Ombudsman. So we have some state contracts and then some federal funding. We have 4 offices around the state. I work in our Milwaukee office, but we also have Madison, Rice Lake, and Menasha. And again, as I said, we have federal and state funded programs, so not just our protection advocacy agency. Next slide. Next slide.
Sorry, Sally.
That's okay. I just wanted to make sure you could hear me. So we were asked to answer a couple questions about our services and supports. And so what types of services and supports do we provide to families of children and young adults? So our advocacy services start with our intake process. So people call in, they do an intake about the issue, and then it gets referred to an advocate or an attorney. And so we do a lot of information and referrals, maybe referring you to other agencies that do something more particular. We provide a lot of heavy technical assistance. We don't represent all families in direct advocacy, so technical assistance is often a very heavy part of our advocacy. We do provide direct advocacy, and that usually looks like attending IEP meetings, mediations, filing complaints, but we really limit that to certain priorities. And our 2 main priorities this year are school exclusion and inappropriate seclusion and restraint. So school exclusion could be when children are being overly suspended, they are up for possible expulsion. It could be placement in alternative schools. It could be shortened day. So we do get so many calls annually that we really have to stick with those priorities. Around seclusion and restraint, it's usually if there's been an inappropriate seclusion and restraint, meaning that the behavior was not necessarily should have been a seclusion or restraint, or if it was done inappropriately, if the child was injured. Those are the types of cases we would look at for that. Some of our direct advocacy obviously is attending those IEP meetings, so that's what we do mostly. But we do often help parents in mediation around these issues. We definitely feel like the mediation system is a great way to kind of end a conflict between a school district and a parent. We do file DPI complaints, often around seclusion and restraint, because we want the department to be understanding what's going on in this area. And very rarely do we file due process, but sometimes we do. We do a lot of training and outreach, so we attend resource fairs. We do different trainings. We've had multiple smaller grants that have focused on training a lot around college and career-ready IEPs and also around transition. So you might see us out there doing trainings, and we love to have as many people to participate as possible. Again, as I said, our families access our services through an intake process. At the end of the slide, you'll see our numbers to call depending on what area you are. And we do have an 800 number that will kind of put you to the right office depending on where you live. Next slide. So the next question was, how do we support school staff? And sometimes people would think, well, we're an advocacy organization and we don't really support school staff. But you would be surprised. We definitely get calls from school districts, from teachers or other people within the district who might want to understand about the law, or they think something isn't quite correct that they're doing at their school district. So we do a lot of we may do just technical assistance in those areas. The other thing that we do is often participate on stakeholder groups. So districts may ask us, depending on some type of policy change that they might be doing, they may ask us to participate as a stakeholder. We definitely collaborate with trainings. We've done a lot of different trainings with the Milwaukee Public Schools. We are often invited to school resource fairs, transition fairs by school districts. We do provide guidance on laws, so if people are like, is that really the law or not? Often it could be a teacher calling that they're just not sure what they're being told by an administrator. And we also do training for future educators. So myself and other advocates have been asked to present at different colleges to help train educators on parent advocacy. Next slide. So what are some of the other things we do that would be unique to our organization? I would say the biggest thing is our public policy work. So we definitely have a robust public policy committee that does a lot of state and federal lobbying around public policies. Right now, obviously, we're working on the budget issues. Not only do we look at the state budget and those things, but we often help draft different legislation and help move forward legislation that might be important for children with disabilities. This is a part of the charge of the Protection and Advocacy Agency, is to really provide that public policy portion for people with disabilities in the state. We receive smaller grants that often focus on family engagement. I think the other thing is that, as I talked about in the beginning, that we support people of all ages. So we're not just an organization who supports children. So if you're a parent with different issues, you may find that you start with us in a special ed issue, and then as your child ages, you may end up calling us for, they may call or you may call for employment discrimination, possibly family care and IRIS issues. So I think that's what is somewhat unique to us. And again, our supports and services are provided through federal and state grants. Next. So this is our contact information. As I said, the toll-free number will route you to the correct office where you live. You start any advocacy process with us through that intake, but then I have our offices listed so you can call them directly. And that's it for me. I think I made my 10 minutes, just a little bit over maybe.
Yes, that was great. Thank you so much, Sally. So now we'll move into the question and answer period for Sally's presentation. Hopefully some of you have entered some questions into the chat. And again, I remind you to please, if you think of something while they're presenting, go ahead, enter it in the chat. So Sherry, I'm going to hand it over to Sherry. Do we have any questions for Sally at this time?
Sherry, I think you'll need to unmute yourself because I'm not having any success.
There are no questions at this time.
Wait, no, there are. Okay.
Oh, wait a minute.
Yeah, I can see him.
Yeah.
I can see him too.
So now there's a question. So what types of transitions issues do you help with?
So in the past, we definitely have helped with transition issues. We do have some other grant funding where we have different people who are able to do that. We did take that out as a specific priority just this year. But generally what we're looking at is if students are being exited early from school, so if school districts are saying that a student has met all the requirements and they're 18 and they should be graduating, but we clearly know that maybe they have not reached their transition goals or that they still need assistance in transition. So sometimes we do call that school exclusion because they're being exited early. So generally those are the types of cases that we would help. But again, we provide lots of technical assistance around transition. The other thing we've done is a lot of training. We actually, if you go to our website or our Facebook page, we have a new guide for youth in transition and several videos on youth in transition. So those are probably the issues that we help with.
Okay. Any other
I can see the questions. It says, does it matter which office you contact or does it depend on the state? So if you call that toll-free number, you will get directed to the office that serves your area. We serve different geographic areas. That's how it works. Then somebody asked if our services are free to families. Yes, our services are all free to families. There's no cost.
Okay. Any more questions that you see there, Sherry or Sally?
That's all I see.
Okay, so thank you very much. So we've just heard from, yep, absolutely. We've just heard from Sally Flashberger. She again is a lead advocacy specialist at Disability Rights Wisconsin. So I want to thank you again, Sally, for presenting today. Next, we're going to hear from Robin Dia. Robin is the Director of Parent to Parent of Wisconsin and is joining us from Rhinelander, Wisconsin today. Thank you for participating today, Robin, and you may begin whenever you are ready.
Thanks, Caroline. I'm happy to be here. Can you hear me?
Yes.
Great. Okay. I'm never quite sure. So that's right. I am with Parent to Parent of Wisconsin. We're a statewide parent matching program. My contact information is on this slide. It's new information because we have changed locations. So please be aware if you have contacts with us. We have new contact information and you can find all of that information on my emails or webpage. Next slide. So Parent to Parent is part of the statewide network of children and youth with special health care needs. I'm just one of the programs within that network. Becky Burns will be up today to talk about all of the programs that are related and sister organizations within our state. So there's some nice wraparound and collaboration that happens within this network. I happen to be part of that wonderful network. I wanted to tell you a little bit about our beliefs and our mission. Back in 2003, Parent to Parent started as a pilot organization or a pilot program in a northern rural county. It was Langlade County where I had started it. And from that, I developed a model for the state of Wisconsin. And in 2005, I received funding from the state of Wisconsin and became part of that collaborative network within our state for children and youth with special health care needs. So back then, and it's never changed. Our belief is that children live happier, healthier, safer, and more productive lives when their parents are strengthened, educated, and supported. And we truly really believe that all families should have access to quality peer support, and I think what our program is all about is making sure that there's a sense of quality to the peer support that we offer. So next slide. What are parent-to-parent programs? There is a network of parent-to-parent programs in the state of Wisconsin. We all fall under our national organization called Parent-to-Parent USA. I was one of the founding board members of the organization, and today we have about 40 states that are member organizations, meaning that each of those states have a statewide parent matching program that follows evidence-based best practices. So it's what we call parent-to-parent programs, are programs that offer a formal matching service to families who are looking for support from another person who's been on the journey, maybe a little bit further on the journey, and we make that one-to-one match. Our program follows 100% of the evidence-based best practices in one-to-one parent-to-parent support through the evidence that was generated from research that was done in the late 1990s and is still quite valid today. Next slide. So what is peer support or parent-to-parent support? It's that intentional connection between a parent who's looking for support and a trained volunteer support parent, someone who's already learned the language of special needs and has found the resources. And we often say that's someone who's been there. We know that when that quality peer support happens and parents benefit from it, that it actually changes, makes changes at the cellular level for parents receiving that support. So that's one-to-one support and parent support. Next slide. So all parent-to-parent matching programs that are connected to the statewide and are following evidence-based best practices have 4 program components. Training, we travel around the state and train families who feel that they can model some resiliency and have that passion to pay it forward, give back to other families so that they don't have to build the road themselves or find the road themselves. They can have a mentor who's been down that road. We offer matching in our state. So I have a database that's about, there's about 700 entries in it and probably about 500 families available to be matched to other families who are looking for that support. We do follow-up as well, and we want to make sure that the match happens, so we follow up at 1 week, and then we follow up again at 6 to 8 weeks, just to do a little bit of a conversational evaluation with families to make sure that they benefited from the support and that it matches some of the benefits that are highlighted in our research. So that is our evaluation piece. Next slide. Thanks. So our trainings, again, I travel around the state and I have partners help me identify a set of parents that are willing and looking to do more and give back. And then I travel to that area. Our trainings are free. They're normally on a Saturday and they're 6 hours long. And because of the quality of our training and the exchange of information that we do and the self-reflection work that we do, they're small groups. So normal training is about 12 people, 12 families. And I do them around the state when I can collaborate with partners or other families who say, you know, I've got a group of friends here that get together and we'd like to participate in this training. I'm happy to come and train wherever I can find that availability of parents. We do some self-reflection during the training. We learn about active listening and supportive communication, and then we practice it. We also look at grief, confidentiality, and we do some role play during the training as well. Next slide. Next slide. There you go. So when we do our matching, we always say that the matching criteria is driven by the parent who is seeking the match, meaning that we don't always match on similarity of disability, but sometimes a parent will call and they'll say, my child is having surgery next week, and I want to know if any other parent has had that surgery with their child. We'd like to match with them. Sometimes families call and say, you know, I'm struggling with feeding issues here. Is there anyone in your database that's had that experience? We can make matches based on whatever it is that that support parent is looking for. Sometimes, you know, it could be about culture. I come from this culture. Do you have anyone from that culture in your database? So we really have an ability to search our database by keyword and really make those matches as closely as possible. We also call it the warm match because we've trained the parents. We've spent 6 hours with them. We get to know the parents so that when a family calls and says, I'd like to have a match, and I have 3 parents in the database that would be appropriate, I can think about what I've learned from the parents seeking a match and the parents in the database and how I think they will fit best together. So that's what we call the warm match. We strive, though we don't always meet that criteria, we strive to make matches within 24 to 48 hours after we've had contact with the parent. So we try to call the parent back within 24 hours. If we don't reach them, we continue to call. The other criteria that we are really firm on is that our support parents make at least 4 phone contacts with the new parent. Research says that's the more phone contacts you have with the family, the greater the relationship happens. And when you build a relationship with a family, there's some reciprocity that happens and some strength building that happens within the family. So families, our support parents, our parents who are trained, are required to make 4 phone contacts with the family, at least. Next slide. Follow-up and evaluation. We do 2 follow-up phone calls, like I said in the first slide. The first phone contact is to make sure that the match happens. So we call each parent in the match. Did you get connected? How did that work for you? Do you feel happy about this match? And then we do the second phone call at 6 to 8 weeks just to make sure that the family benefited from the match, to see if there's anything else we can do for them, or to help them get connected to resources available in the state. Next slide. Thank you. I talk about getting parents connected, and I wanted to let you know that on our website, there's a picture of our brochure, which is highlighted here. You can go there, click on the picture, and order free brochures from the parent-to-parent program. Again, here's our contact information. Get it in the hands of families if you can. It's important because we know the benefits for peer-to-peer support is not only multi-generational. Parents who receive this support can often model self-advocacy skills, and because of that, their children become better self-advocates as well. So we know that it matters. Next slide. I always ask providers to think about making a direct referral for families, because families are, when they're looking for support, oftentimes it's during a time when they feel somewhat fragile. So I ask for families to, for providers to make that direct referral. And this is a shot of my website Get Connected page, where you can fill out the information for a family and hit send form, and it comes directly to the parent-to-parent program. Then we contact the parent and make that match. All I need even is just a name and a phone number, and I can get connected with that family and start the process of making a match. Next slide. Yep, building family resilience. When families receive and benefit from support, we know it makes a difference at the cellular level. We know that big changes happen for families, and families feel like they can take one more step and pretty soon they're running. So here's a response from one of our parents who received support from one of our support parents, and it was around her child with schizophrenia. She said, "She's been absolutely amazing. It's so nice to talk to another parent with the same issues. Thank you very much. Best program I ever received." Or I received yet, sorry. Yep. I think that might be it. Check the next slide.
Yes, I think that was your last slide, Robin.
Yep, that's my last slide. So I may be a little bit short on time, so that gives us time for questions.
Yes, absolutely. So
Awesome.
thank you again, Robin. And now we will move into the question and answer period for Robin's presentation. So again, I'll go to Sherry to see if there are any questions in the chat for Robin.
Caroline, can you hear me?
Yes.
Okay. There are no questions at this time.
Okay. All right. Thank you, Robin. Again, we have just heard from Robin Mathia, and she is the Director of Parent to Parent of Wisconsin. And so thank you again, Robin, for presenting today. Okay, so now joining us is Becky Burns. She is the statewide coordinator for the Wisconsin Children and Youth with Special Health Care Needs. Again, we thank you, Becky, for contributing today, and you may begin when you are ready.
Thank you very much. And now I see there is a question for Robin, and so we can address that perhaps in my question and answer point, or Robin can reply through the chat box. So thank you very much for inviting me to present about Children and Youth with Special Health Care Needs program here in Wisconsin. I'll share with you some of what we're doing in the area of family leadership and support. Next slide, please. Children and Youth with Special Health Care Needs, what we often just abbreviate with CYSHCN, is part of our state's Title V program funded through the Federal Maternal and Child Health Bureau. Our mission is that children and youth with special health care needs are identified early, receive coordinated care, and that their families have access to the supports they need. Next slide, please. Our network also shares some common set of principles which are embedded into all of our programs. They are: children are best served within their families, children, youth, and families are best supported within the context of community, families will have convenient access to care planning, collaboration is the best way to provide comprehensive services, and the family perspective and presence must be included in all aspects of the system. I suspect many of you share these principles. Next slide, please. Our network includes agencies such as the Youth Health Transition Initiative, the Wisconsin Medical Home Initiative, Family Voices of Wisconsin, Parent to Parent of Wisconsin, ABC for Health, and Well Badger Resource Center, in addition to our 5 regional centers. We provide funding from the federal Title V block grant to these programs to carry out our mission. Next slide, please. Our 5 regional centers were formed to better serve families throughout the state of Wisconsin. The regional centers provide information, referral, and assistance to both families and professionals who work with children and youth with special health care needs. The staff at our regional centers describe their work as diving in, being with, and walking along the side of parents. They also have shared with me that we spend as much time as needed, as often as needed, and as long as needed. And when asked, parents tell us that you listened, you helped me find my next step. I'm sorry, you listened, you helped me with what I thought was important, and you helped me find my next step. So often parents, like all of us, simply don't know what they don't know. So our resource centers will explore a variety of issues and provide resources to support a wide range of needs. Next slide, please. Keeping in mind that our CYSHCN network assists families in an array of services, including insurance and benefits access and advocacy, but I will be focusing my response to the support provided through our regional centers. Our two primary support services are phone and drop-in support and family-focused training opportunities. We have information and referral specialists available to answer calls and emails from family members about any topic related to raising a child with special healthcare needs. They have vetted their referral sources prior to sharing them with families and will call back in a few weeks to ensure that the family has received the support they were seeking and to check to see if they have any new needs that have surfaced. We also have trained all of our regional center staff to be able to provide high quality training for families on topics such as moving from pediatric to adult healthcare and issues related to having a positive medical home experience like care mapping or partnering with your child's doctor. Next slide, please. Anyone can call our regional centers and get answers. If school staff are seeking resources for their students, our staff can help them get pointed in the right direction. We also have a curriculum called Bridging the Gap, which is tailored to a variety of professional staff, including teachers. That training presents the foundational knowledge about youth health transition and then helps teachers figure out how to help their students learn what they need to know to maintain their own health. No student can succeed in post-secondary career or advanced education or independent living for that matter if they're not managing their own health. Thus, we think it is critical that issues related to one's own health are integrated into IEPs for students who are going to need extra support to learn these life skills. Staff from our regional centers also serve on multiple county communities on transition, or CCOTs, in local CSIS districts across the state. Next slide, please. Some of our CYSHCN network partners are sharing information this morning about their approach to supporting parents. You just heard from Parent to Parent of Wisconsin, and I know that Family Voices as well as Well Badger will be speaking shortly. They will be able to answer the question about building a family and educator capabilities and capacities far more thoroughly than I. But I can add to the discussion that we have regional center staff who work with families who serve as representatives on healthcare clinic quality improvement teams. And to that end, we created a team engagement booklet that helps professional team members and family team members see the value of each other's perspective and work together for positive change. That sums up my presentation, and I want to thank you for taking the time to hear what we're doing through the Children and Youth with Special Healthcare Needs program. Thank you.
Thank you, Becky, so much for that presentation. So we'll now move into the question and answer period for Becky's presentation. And Robin, if you're still on, we can also take questions from your presentation before we move into Becky's questions. So Sherry, do we have any questions? Well, we have a question for Robin, at least one, and then do we have questions for Becky?
So there are no questions for Becky right now, but we do have the one question for Robin. What is the age range of the children who are parent peers or receive the service? So if Robin is still on.
She is, and she's unmuted.
I am still. Yep. Can you hear me?
Yep.
Yes.
I think you can at this point. So we receive funding that supports our work with children and parents who have children age birth to 21 years of age. We don't turn away anyone who has children that are older. I do have older children in the database. Our focus is basically birth to 21, but we serve across the lifespan. in a limited way with older parents of older children that are still in our database. We keep, every year we get older. So yeah, that's our focus.
Great. So here is a question. Can you contact the regional centers that you don't live in for help or go to their events? So I think this is for Becky.
Mm-hmm.
I'll just unmute myself. Yes, you can. I'm not sure what situation that might be, but often, for example, families may be in a hospital setting in a region other than their home region, and certainly our regional center staff are happy to assist from whatever part of the state. It's likely that they're going to try to connect you with the regional center closest to your home, because of course there are regional subtle differences throughout our state for services that are available, and they want to make sure they connect you to exactly what's best for you in your hometown. But yes, you can attend our trainings throughout the state, no problem whatsoever.
Great, thanks, Becky. Are there any other questions from any audience members? All right, I don't see any other questions here.
Okay, thank you, Sherry. So again, you've just heard from Becky Burns. She is the statewide coordinator for Wisconsin Children and Youth with Special Health Care Needs. And we want to thank you again, Becky, for presenting today. Okay, so next up, we have, we have Jenny Newgart, and I don't believe we have her presentation in this. Is it okay if Lynn goes, since we have her presentation up here, and we can move Jenny to the next slide? Sure. Lynn, would you be ready to go? Okay, so let me introduce you, please. So our next presenter is Lynn Renner. She is the Communications and Information Coordinator at Family Voices of Wisconsin. So thank you, Lynn, for joining us today, and you are able to begin when you are ready.
Okay. So I'm Lynn Renner from Family Voices. Let's see. I guess next slide. So we're a network of families who have kids with disabilities and special health care needs. Oh, sorry. Mute everything here. As I said, we primarily focus on healthcare and community supports, education and information. Next slide, please. So as Becky and Robin mentioned, sorry you guys, what's going on here? We are a part of that same great network. And so we work very closely with parent to parent and with the regional centers and Well Badger. And in many cases, when parents need one-on-one information and referral, we can send them to the regional centers or Well Badger. Next slide, please. So I don't need to read our whole mission. I guess you guys can probably do that. But I mean, I think really what our philosophy, what our mission talks about is that we focus on strengthening families' ability to care for their children, and we provide them with tools and resources to make their lives a little easier, to make their navigation a little bit easier. So next slide. So our work in terms of working with families directly We work on our focus areas are education and training, information, and family leadership, as well as public policy. So for education and training, as I said, we work very closely with the regional centers, and we have both face-to-face and online trainings. Those include our Did You Know, Now You Know training that really focuses on families of children with younger children, like ages 14 and under. We have a very popular and well-received training called What's After High School. And those in the last several years have been hosted through high schools and through school districts. So that's an area where we've had really great partnerships with schools to bring those face-to-face trainings to families. We also have an online, primarily online training on care coordination and medical home, and that's called Coordinating Your Child's Healthcare. And then we have a newer training that's been piloted just recently called Medicaid Basics or Medicaid Made Easy. So that's a training that we plan to do more in the future. We also have other shorter training sessions that we can host depending on a community's interests and needs. Liz Hecht does a great training on supported decision making and talking about guardianship and alternatives to guardianship. And then Barbara Katz has done a great training recently with the PIP, with the WSPEI PIP program called Telling Your Family Story. So next slide. In terms of information, all of these are available on our website. We have about 30 different fact sheets, and those take a topic, anything from, what is respite? What's the difference between personal care and respite? Can my child, can Medicaid pay for diapers? What about MTM and service and transportation? So it's really, a lot of topics and questions that families may have, and we put them into straightforward 2-page fact sheets. We also have quarterly newsletters, and we really try to address questions or topics that families may have, things like changes in the CLTS program, or getting ready for your child's new school year, or really, things, our winter newsletter talked about some of the stresses that families may experience if they're visiting or if they're traveling away from home, visiting family. So we try to really listen to what families are asking and talking about during our sessions, and then put those into both fact sheets and newsletters. And then, like I said, we have a great new website, so you can find all of our fact sheets and newsletters on our website. Next slide. In addition, our work is very much focused on family engagement and family leadership. And a few examples are our Advocacy for Change, which is our one-day advocacy and skill building training. That's always in March, and that's free to families. And we certainly encourage school districts and individual schools to talk to parents about this opportunity. We also have a Family Action Network listserv. And in addition, when we are able, we try to connect families who we meet, certainly through the FAN listserv and through our advocacy group. When we hear about statewide or regional committees or advisory boards, we try to connect those families and encourage them to participate. So next slide. So as this says, we're active members of several statewide groups, including the Survival Coalition, and Liz Hecht is our policy lead on our policy area. So 3 things that I wanted to mention in terms of the current budget that we're really talking to families about, putting out on our listserv and Facebook, and helping to educate families about these 3 things: ending the children's long-term support wait list, creating family support and disability resource centers, and then finally increasing funding for special education. Next slide. In terms of partnerships with schools, I guess I also already mentioned that we do in-person trainings. Those have primarily been at high schools, and we're always open if you hear of school districts or individual high schools who are interested. We can bring our training. It's free to that school, and we usually work with the regional centers to host those What's After High School trainings. We also try to provide trainings and materials to schools, and like I mentioned in our newsletter, we try to have topics and articles and information for families so that they can be educated and informed partners with their school to get the services their children need. And I just have the link under our new website, under Resource Library. You can find information on our trainings and our fact sheets and our other resources. So I think that final slide. If you have any questions, you can certainly email me, and I think that's my my presentation. Thank you.
Okay, thank you, Lynn, and thank you so much for popping in there early. We really appreciate it. I'm wondering, is there anything you want me to go back to on any of your slides that maybe you felt in the beginning that you wanted to revisit, or you feel?
Well, sorry, I was going to say I just saw a question, and somebody asked if I wanted a training. So all you have to do is email me, and I can work with you on setting up, finding dates, and setting up a What's After High School training.
Okay.
And there's a follow-up question on there for you. What info do you all cover?
So it's a very broad overview of the transition from children's services to adult services. It's, we don't, it's a 2.5-hour training, and there's so much to cover. We try to do an overview of, working with your child's team and, thinking about what classes they might want to take, about your child being involved in their IEP, then transitioning from the children's services to adult, to family care or iris. Let's see, we talk about moving from children's health care to working with an adult physician and having your child involved in healthcare decision making. We talk about the legal changes and guardianship versus supported decision making. And let's see, and then we talk about community living, and that really means everything from employment to what does your adult child want to do with their free time, besides working. What kind of community supports would they need? Where would they want to live? So yeah, it's really a broad overview of all of the topics that a family would need to consider as their child moves from, starting at age 14, 15, 16, all the way through age 21 and beyond. One thing I will say is that we have a really helpful binder of materials. So while we can't really go into specifics of any one of those topics, there is a lot of information in each one of those binders. So each participant will get a binder to bring home with them.
That's great, Lynn. Thanks. So there's another question here from one of our participants. So when we talk about families with long-term supports for adult students, can you assist them in coordinating healthcare supports?
Well, I would say we can give them general information. I mean, and like I said before, we really, because we're a very small staff, we do a lot of the information and training at, you know, a group, but we don't do a lot of one-on-one information and referral. So we would really direct that family to their regional center, or depending on the child's age, to their Aging and Disability Center, to the ADRC, get some of those specific questions answered.
Great. Thank you, Lynn. And so that's it for the questions that people have sent through.
Okay, thank you, Sherry. And again, Lynn, was there anything in your presentation that you feel you might want to go back and touch on? Or I appreciate very much you jumping in at the last minute.
Yeah. You know, the one thing I want to mention, just because it just happened last week, is that Family Voices has gotten very involved in the planning of the Circles of Life conference. And I know, Carolyn, you were there. Many of the others who are on the call were a part of that Circles of Life conference. So for anyone who's on the call who's not familiar with that awesome event, I would encourage you to learn more. It will be next in 2020, it will be in the Dells. And in 2021, it's actually the 7th and 8th of May next year. And in 2021, it will be back in Stevens Point. So that's an event that brings together all of the agencies who are on this call, many school districts, many families, other county providers, and it's just an awesome way for both school districts, staff and families to connect one-on-one, to learn about, we had over 30 breakout sessions on a huge variety of topics. So I would just say, you know, check out the Circles of Life conference.
All right. Thank you, Lynn. I absolutely agree. It was a great conference, and a lot of networking and relationship building can take place there. So again, you've just heard from Lynn Renner. She is the Communications and Information Coordinator at Family Voices. And again, thank you, Lynn, for presenting today. So I'm going to take a short break now and find Jenny Neugart's slides, because Jenny is up next. She's the one that we skipped. So now would be a good time. Yes.
This is Evelyn. I did drop those slides in, so if you go back to the Google Drive and reopen the presentation, they're there. In the Team Drive in the presentation. Yep.
Okay, I will be back in just a minute. Are we ready? I'm sorry.
Yep. Sorry.
Okay, here we go. Okay, so today I have the pleasure of introducing Jenny Neugart as our next presenter. She is the grassroots community organizer at the Board of People with Developmental Disabilities. So we thank you, Jenny, for presenting today. I apologize for you going a little bit later, but you can begin when you are ready. Thank you.
Okay, thank you. So as Carolyn said, I'm with the Wisconsin Board for People with Developmental Disabilities, and we were established to advocate on behalf of individuals with developmental disabilities, foster welcoming and inclusive communities, and improve the disability service system. So Congress actually found that disability is natural and shouldn't preclude people with disabilities from having control and choice in their lives and fully participating in their communities. So they authorized the Federal Developmental Disabilities Assistance and Bill of Rights Act, we just call it the DD Act, to help states reach out to people with disabilities and family members to make sure they're fully included. So every state and territory has at least one DD council. Next slide. I should have said that before. And next slide, please.
Are you seeing it?
Yeah, can you see the next one?
The next one? Okay, I'm sorry. Okay, sorry.
So our mission statement is to help people with developmental disabilities become independent, productive, and included in all facets of community life. And we do that with advocacy, systems change, and really just trying innovative things and seeing really what sticks so we can expand that throughout the state. Next slide. Oh, that's not the next slide.
That's what I was just going to ask you. I don't know what it's doing here.
Okay.
Hold on a second. Let's do this. Sorry about that. Okay. Let me get the closed captioning up here. Oh. Let me try it again. Sorry, technical difficulties, right? I need to add something else here. Okay, I think we're just going to have to go this way, Jenny, and we'll go through them with this format. I apologize for that.
That's okay, that's fine. Okay, so we were asked to talk about some of the resources that BPDD provides, and these are just some of the resources. We have a lot more, but I thought these were most relevant to the audience. One of our most popular resources right now that we have trouble keeping in stock is Supported Decision-Making Toolkit. We had a guidebook that many of you have probably seen, and we've now created a toolkit that includes forms and one-pagers, and it has more of the information that people were really asking for, and the guide was more of an overview. So as you may know, supported decision-making is an alternative to guardianship where people with disabilities can use friends, family members, or professionals to help them understand different situations and choices so they can make their own decisions. So it's really the way we all make our own decisions, asking trusted friends and allies to help explain things we don't understand so we can make an informed choice. It's much less restrictive than full guardianship, so it's something we're working really hard to especially let teachers and parents know about, because a lot of times teachers just steer parents directly to guardianship. And this is a fairly new choice, so we're doing a lot of educating on what supported decision-making is. We also have legislative directories. A lot of people ask for them. It's sort of like a pocket guide of all of the legislators in the state, including the committees they're on. So a lot of people keep it in their bag and they can pull it out and look up their legislator, because we often ask people to make calls to their legislators about certain bills or funding issues. We have a healthcare toolkit, which basically is just a folder of information that would have all of your main healthcare needs right at your fingertips. And then you can just grab that folder, go to the doctor, and have everything you need. And it's very helpful for people with developmental disabilities, because there's even like pictures of the body so they can point to, you know, where it's hurting and things like that. So that's also popular. And then we also publish budget platforms. Like this year is a budget year, so we've done a lot around that and budget trainings. And we have impact papers on our projects, so it's sort of like our return on investment of the work that we're doing through BPDD. And then we also do provide, you know, information and referral services. So we get a lot of calls from people who just aren't sure where else to go. So I had a call recently from a person who was having questions about her benefits and was very confused about how working would impact those. And we don't provide direct services at BPDD. That's not our charge, but I did give her phone numbers of where to call, and she's connected to DVR, so I suggested she ask for a benefits analysis. So we really do just get people to where they're going, and most of our calls are people with disabilities who are just really struggling to navigate the system. Next slide.
Sorry, give me a minute here. This is stubborn. Okay.
Okay. The next thing that I'm going to talk about is the ways that we provide services and supports to schools. And one of the main ways that BPDD has done that is through the Let's Get to Work grant. It was a 5-year systems change grant focused on getting high school students with disabilities jobs in their community. And we worked directly with 12 high schools during this time where they got training and coaching on best practices. And actually, we tripled the employment rate of the students who were involved in that pilot program. So we took those best practices and the on-the-ground experiences of the teachers, and we created a quick guide for teachers with the idea that they could, it's basically a series of one-pagers. So they could, you know, pick one of the one-pagers and maybe just pick 1 or 2 activities on that one-pager to try. So, you know, it's not a whole curriculum. It's not meant to overwhelm, but, you know, just pick it up and try a couple things and see what happens. So the quick guide is available online. The entire guide is online, and I still have some print copies that are available through me. My contact information's at the end of the slide, so people can contact me if they would like to get one. Next slide, please. And then towards the end of the project, the Transition Improvement Grant was looking for ways to help schools that were struggling with poor transition outcomes. So they asked if they could use some of the techniques we used with the pilot sites with the schools. They call them CBIE schools, Community-Based Integrated Employment Schools. And we were thrilled to see, you know, techniques spread beyond the pilot sites. So we definitely worked with them. Some of our coaches did some training with those schools. They held community conversations like our schools did. And they also kind of used the coaching model with the quick guide to work with the CBIE schools, but also other schools. And then our pilot sites also mentored other interested schools, so we spread the work even further. And I did want to mention, we have videos on our website of students with more significant disabilities working, because we found at the very beginning of the project that people need that visual that students with disabilities can work in the community. So we created some videos throughout the project. So the project has ended, but like I said, all of the content and especially that quick guide is still very much available and current and useful for people to use. Next slide, please. So BPDD also works with schools through the Promise Family Advocate Project. So you're probably familiar with Promise. It's a $32.5 million grant, and it was for transition age youth who receive SSI, and really to get them, you know, competitive employment in integrated settings, have a stronger financial future, and raise the overall household income of the participants, because it looked at the whole family, not just the student. And there's a portion of that project that included regional family advocates, and that piece was subcontracted to BPDD. So that's kind of run through our office. And those family advocates are fantastic. They spend a lot of time working directly with families and students on a lot of issues, from truancy and homelessness to, you know, how to get supports at the IP meeting. And currently those families are working, they can apply for small grants and work on an issue in their community. And they're receiving help from the family advocates to do that. So that project is going to be ending soon, but the family, well, in September, but the family advocates are still out there, and they're really the touchstone for families through that grant. Next slide, please. And then some other ways that we get involved at the transition level is we're part of the Wisconsin Community on Transition, which meets a couple times a year. And it's really various agencies, such as the ones on this webinar, working together so we can complement the work that we're doing and assist each other and, you know, try to spread further throughout the state without stepping on each other's toes. And then we do other things like we were at a Special Olympics event last Saturday where there's hundreds of families that we wouldn't have ordinarily reached. We go to transition fairs and other resource events. We're on the Circles of Life Planning Committee, which is a fantastic families conference that Lynn talked about. And BPDD is especially interested in increasing diversity for that. So we sponsored scholarships for Hispanic families to be able to attend. And then BPDD puts out action alerts, and we're very active on social media. So action alerts are kind of like, you know, the budget hearings were just going on. So, you know, there's a budget hearing in your area, please attend and testify, and here are some brief bullet points that you could use to do that. Next slide, please. And then some of our projects that help with leadership and advocacy for families and educators. The Partners in Policymaking project is a 6-weekend training for family members and self-advocates over the age of 18 to learn about legislative advocacy. So they learn a little bit about the service system, but it's also focused on how do you talk to your legislator? How do you set up a meeting? How do you testify at a hearing or use social media for your advocacy work? So we do a lot of role plays, and they have homework in between that would include actually meeting their legislator. It's a really great program. Our graduates have gone on to be elected to their school board, to start organizations or chapters like People First. If you're familiar with Save Iris, that came out of Partners. A group of partners created that. And we have a new class that starts each fall, and applications will be out sometime this month, probably more towards the end of the month. Next slide. People First is also under the BPDD umbrella. There's about 20 chapters throughout the state where self-advocates meet regularly and work on issues that they identify as important to them, because that's certainly different by community. Many chapters have met with legislators and worked on issues like transportation or voter accessibility. And BPDD really provides the technical assistance to People First to help them improve the work they're doing with the chapters. Next slide. The Youth Leadership Forum is a really direct way that we work with high school students and teachers. It's a week-long opportunity for high school students with disabilities to come to Madison for a week. They stay on a college campus for the whole week in the dorms. They learn about leadership and self-advocacy. Speakers come in and talk about college, living on their own, technology, employment. They meet in small groups. They develop a personal leadership plan. They have a mentor picnic. They spend the day at the Capitol and meet their legislators. And they get to do fun stuff like a talent show and a dance. But they've really gone on to become strong advocates. A lot of them have led clubs in college, become board members of different organizations. And one of our graduates is city councilman. So interested youth do need to apply for that, and they are selected to attend. So we definitely want to spread the word about that because we want to get more youth to apply. We can take up to 30, and we have about 24 right now. So, and it happens every year. Next slide. The family-led projects through BPDD are a network of families with children transitioning from high school or like young adult children that are committed to educating themselves on, you know, what's next in adult life for their child with a disability. So it's really a way for the families to work together to identify their needs. They decide a focus for their group. It could be learning more about how to self-direct, creating circles of support, housing, transportation, but they meet and they learn about resources, they provide support to each other, they do person-centered planning together. One of the family or one of the groups of families actually, their daughters ended up liking each other and working really well together, so they ended up becoming roommates, which was a really great outcome. So we do have projects right now in Milwaukee, Waukesha, and McGuanago, and Lovedale has a contract to basically provide support to those family-led networks. Next slide. One of the most direct ways that we provide education and skill building is through our self-determination conference. It happens every year in the Dells at the Kalahari. There's a different theme every year. This year it's technology. Last year was superheroes. So I put an example of, that's actually Russell from our office. They picked, I don't know, like 7 or 8 self-advocates and turned them into superheroes. So that's Russell. We always have transition-focused sessions at the conference, and a few years ago we started offering family scholarships. So it's intended for like a high school student to come with a parent or teacher, so the scholarship covers both people. In the sessions, I have to say, they work really hard to make sure speakers include an activity during the session so that it's very friendly for self-advocates to attend and get something out of the conference, because we do get a lot of self-advocates that come, and there's usually about 600-700 attendees each year. Next slide. I think the last one. So that's just like some of the projects, like I said, I thought were most relevant to this webinar. We have a lot more projects around like voting and employment and things like that. So you can definitely check out our website. I've got the address there, and see what else we offer. You can sign up for free emails from BPDD, which include our monthly newsletter. We'd like to keep it short and sweet because people are busy. And then that's where you would also get action alerts. If nothing else, it gives you information that's condensed to be a little more understandable. Our policy person actually read the governor's budget like overnight and condensed the disability-specific information into understandable paragraphs for people to be able to advocate for it. Like us on Facebook. We have over 6,500 likes, or about 6,500, and we're very active. So you can get a lot of information just by doing that. And we also are offering our newsletter now in Spanish, so we're trying to definitely reach out to more diverse communities. And if you have any questions, my contact information is there. Feel free to contact me anytime, and I can get you connected. Thank you.
Okay, thank you, Jenny. And again, I apologize for not having her presentation ready to go, and I apologize, Jenny, for the formatting piece. I'm hoping to be able to connect with you a little bit later down the road so we can record a nice piece for BPDD so we could present it and we could get the captioning on it and that type of thing. So again, thank you very much.
Sure.
So we'll now move into the question and answer period for Jenny. So Sherry, do you have any questions for Jenny? And while you're doing that, I'm going to try to get this presentation reloaded so we can be up and going with the captioning when we come back to the next presenter. But go ahead, Sherry. Are there any questions for Jenny?
Caroline, there are no questions for Jenny at this time, and we are 6 minutes behind.
Yes, I knew we were. So let's just take just a really short break here while I try to get this presentation reloaded so we can get the captioning back on. And if anyone wants to enter in questions, when we come back, we can answer those, or you guys can just go ahead, Sherry, and ask those questions to Jenny while I'm trying to get the presentation reloaded. Thank you. Yet.
There are no questions.
Okay, thank you. And again, We just heard from Jenny Newgart. She is the grassroots community organizer at the Wisconsin Board of People with Developmental Disabilities. So thank you again, Jenny, for presenting today. We really appreciate that.
Thank you.
Okay, so our next presenter today is Julie Quigley. And Julie is the Director of Education and Outreach at Autism Society of Southeastern Wisconsin. And she is also representing the Autism Society affiliates across Wisconsin today. So thank you, Julie, for joining us today, and you can begin when you are ready.
Okay, thank you very much. As Caroline has said, today I'm going to be talking more about the Autism Society affiliates across Wisconsin, so not so much specifically what we do at our branch, our affiliate in southeastern Wisconsin. You're going to get a little more of a broader overview than you would usually get, but also good to hear some of this background. So the Autism Society's mission is to improve the lives of all living with autism. And I'm sorry, you could go to the next slide. I got to remember to tell you that. The Autism Society of America was formed about 50 years ago by parents to provide support for one another and to advocate for inclusion, improved education, and better services. Across the United States, there's 80 different affiliates. So each year, people with autism, families, and professionals volunteer thousands of hours to help the Autism Society achieve its mission. Our organization model involves the support of the community. We strongly encourage and welcome families, professionals, and individuals living with autism and opportunities to participate in our governance, in our committees, and as staff members. Because who better to understand the strengths and struggles than those directly impacted? As mentioned earlier, our vision is to increase the quality of life for everyone living with autism. And when we say quality of life, we're talking about basic human rights that allow people to interact with one another and the world on their own terms. The quality of life indicators, such as the ability to communicate, the freedom to choose a career, and opportunities for community involvement are essential aspects of the human experience. And we promote treatments, accommodations, and acceptance with them in mind. So we're committed to supporting the following 15 ideals. Respect and dignity. People with autism should feel respected by those around them. Inclusion. People with autism should be welcomed to participate actively in their schools, workplaces, and communities. Communication. People with autism should be able to express themselves and interact with others in a meaningful way. Health and well-being. People with autism should feel and be well physically and have access to the services they need to stay healthy. Safety. People with autism should feel secure and be able to get help from their communities, law enforcement, and others as needed. Academic success. People with autism should have the opportunity to participate in school to their fullest capability and learn in an environment and a manner that enables them to succeed. Social connections. People with autism should have friends and supporters as well as ties to their communities. Independent living. People with autism have the right to lead their own lives, and they should also have the support if needed to help in caring for themselves. Meaningful employment with fair wages. People with autism should have the opportunity to do work that contributes to their communities and should receive compensation benefiting their positions. Financial stability. People with autism should be able to afford the things and services they need. Recreation and leisure. People with autism should be able to pursue their interests and spend their free time in a meaningful way. Subjective well-being. People with autism should feel happy and enjoy life. Self-identity and acceptance. People with autism should understand and appreciate themselves and feel understood and valued by others. Autonomy and self-sufficiency. People with autism have the right to make their own decisions and pursuit of dreams. People with autism should feel empowered to achieve their aspirations. So I know that's kind of lengthy, me going through that, but I think it's important because it tells you what really drives everything we do and drives everything that the Autism Societies do across the nation. So that's really the core of who we are. But in Wisconsin, there's 3 different Autism Society affiliates that collectively cover the entire state. So there's the Autism Society of Southeastern Wisconsin, the Autism Society of South Central, and soon to be the Autism Society of Greater Wisconsin, which is formerly known as the Autism Society of Wisconsin. So the Autism Society of Greater Wisconsin has 5 additional local affiliates under its umbrella. The Autism Society of Central Wisconsin, the Autism Society of Chippewa Valley, the Autism Society of Fox Valley, the Autism Society of the Lakeshore, and the Autism Society of the Northeast Region. So there on that slide that Caroline has up, you can see which affiliate your county lies in. So there are the 3 separate affiliates, as in Southeastern Wisconsin stands on its own, as does South Central. And then the smaller affiliates are encompassed within the Autism Society of Greater Wisconsin. Next slide, please. Because of the demands of living with a person with autism can be great, the families sometimes experience higher levels of stress. The Autism Society affiliates provide many services and supports for families and children and young adults with autism. All affiliates focus on helping parents and caregivers learn how to better deal with behaviors, serve as a resource when pursuing treatments, and work on helping individuals with planning for the future. We recognize the person living with autism can and should be able to maximize his or her quality of life and oppose any denial of their opportunities. So a major focus of our services and supports are centered around this. We take a holistic approach and encourage the whole family to stay involved and focus on what the community can do. Specifically, the affiliates in Wisconsin provide helplines to assist families by phone, email, and in-person support groups. We assist families who have a newly diagnosed child, as well as individuals who are just diagnosed, to connect the supports and services through the autism orientation programs, such as Autism 101 and New to Autism. We also publish a book called Next Steps for families to help them understand how to proceed with this new diagnosis. We host facilitated social events for children, teens, and adults with autism. We make sure to provide events that serve individuals and their families across their lifespan. These events help to build community, as well as provide an opportunity for families to network with each other. There's a lot of comfort and power in being around other people who understand your journey. We host events so people with autism can learn valuable skills, such as bike riding and air travel. Why is this important? These programs support the mission of improving lives. Movement is an important aspect of the bike program. The bike program provides success through experience. Every effort is acknowledged for each unique person's individual abilities. Recreational skills can be difficult to master for individuals with disabilities. Breaking the skills into small, achievable goals and celebrating each accomplishment builds the self-esteem and confidence needed to continue the challenges of learning. The same applies to the air travel program. The programs are designed to alleviate the stress that families have who have a child with autism or an intellectual or developmental disability experience when flying. Families are given the opportunity to practice entering the airport, obtaining boarding passes, going through security, and boarding a plane. Airport, airline, transportation security, administration, professionals, and other personnel have an opportunity to observe, interact, and deliver their services in a structured learning environment. It provides families the opportunity to soar. Education and training is provided to parents and other community members who interact with our families, including child care providers, educators, and law enforcement. Many affiliates have conferences on current topics or speakers throughout the year, and several affiliates have resource directories. These directories are made up of providers in the affiliate's area who work well with individuals on the spectrum. Next slide. The autism affiliates provide services and supports to school staff of students with disabilities ages 3 to 21 in several different ways. We provide family perspectives and autistic perspectives for in-services and panels. These individuals can bring their experiences to the committees they serve on. We provide resource materials, including Growing Up Together, Building Our Future, Educating Students on the Autism Spectrum for Teachers, or additional education and training opportunities for educators. We provide resources through our website and lending libraries. Many of our Facebook posts reflect current stories about autism in the news. Autism Change Champions is an awareness education campaign for both staff and students at the elementary and middle school level. Next slide. Many of our services, supports, and programs build educator capabilities and capacities. Our organizations are governed by board of directors that include parents and people with autism. They provide planning and visioning, financial oversight, assistance with fundraising, and governance. We develop an advocacy skills in people with autism and their families who wish to affect public policy. Family members, educators, and people with autism plan and help to deliver all of our programs. The statewide essay contest takes place each year. This contest provides a way for teachers to talk about autism in their classrooms and to increase general understanding of autism in schools. Our staff and board members are active in the statewide community of practice on autism and other developmental disabilities and leadership roles. One last thing is important to note is that the Autism Society affiliates do not receive state or federal money. We raise all of our operating funds from individual donations and events. And any questions?
Okay, thank you, Julie. So yes, we'll move into the question and answer period for Julie. I'll turn it over to Sherry to see if there's any questions in the chat, or if Julie even sees some in the chat that someone has asked.
I do not see any.
I don't see any questions at all.
Okay, thank you very much. So you have just heard from Julie Quigley, the Director of Education and Outreach at the Autism Society of Southeastern Wisconsin, but was also representing the Autism Society affiliates across Wisconsin. So again, thank you, Julie, for presenting today. Okay, so joining us next are a couple of presenters. We have Christine Balinese, and I hope I pronounced that correct. I worked with her on that a few days ago. So Christy is the manager of maternal and child health programs at the Wisconsin Women's Health Foundation, and her colleague, Chanel Thomas, is an information and referral specialist at the foundation. So I want to thank you, ladies, for joining us today, and please begin when you're ready.
All right, thank you, Caroline. This is Christy speaking first, and again, I'm the manager of MCH programs at the Wisconsin Women's Health Foundation. And today I'm co-presenting with Chanel, and you will hear from her shortly. But today, the two of us are going to introduce you to the Well Badger Resource Center. Next slide, please. To begin, just a little bit about us. So if you haven't heard of Well Badger Resource Center, that is okay. We're fairly new. We are the new home to the state-funded hotlines. There are 3 of them that have been in existence for several years. You might be most familiar with Wisconsin First Step. There's also the Maternal and Child Health Hotline and the Informed Consent Hotline. So those 3 hotlines have been around for a while. They're still in existence. The only difference is they have been moved under the Well Badger Resource Center umbrella, and which has been operated by us at the foundation since last year. And the hotlines in Well Badger are funded by the Wisconsin Department of Health Services, Maternal and Child Health Programs, focusing on the following programs here. Next slide, please. So a little bit about what we do. At the Well Badger Resource Center, we provide health-related information referral services to individuals, families, and health professionals and other professionals throughout the state. We really specialize in referrals for pregnant and postpartum women, children and youth with special health care needs, and low-income individuals and families. But we serve anyone, so anyone can call us. Our focus topics are displayed in the graphic to the right, and you can see children, youth with special health care needs is one of our big ones. But we also provide information referral for these other topics as well: healthcare and coverage, financial assistance, mental health and substance use, pregnancy and parenting help, and nutrition services. And as you can imagine, there's a lot of overlap between all of these, so we take a very comprehensive approach to our services. Next slide, please. So a little bit about our team. We are located throughout the state. The foundation itself is located in Madison, but we have team members all over the state. For Well Badger, we're in Madison, Milwaukee, and Rhinelander at the moment. And we kind of fall into two different categories, but we all work very closely together. First, we have our AIR certified information referral specialists. So these are the folks that are on the phone, checking email, checking text messages to provide high quality information referrals and follow-up services. The other side of our team are our database staff. So at the moment, we are working really hard to launch an online searchable database that has all different statewide resources for the topics that I showed you in the previous slide. So far we have close to 3,000 services listed there, and we're working really hard to verify all that data and have it launched by June 1st. So that will be accessible to the public and to health professionals as well. So that's the two kind of groups of people that make up our team. And to talk a little bit more about the information referral sides of things, we have Chanel, and I'm going to pass it over to her to talk about the services that she provides. So go ahead, Chanel.
Okay, next slide, please. There are 4 information and referral specialists here at Well Badger. I am one of them. We're available Monday through Friday from 7 a.m. to 6 p.m. Any after-hours calls will be returned within 24 hours. We have interpreter services, and individuals can reach out directly, or health social service providers can call on their behalf. Next slide, please. Coming soon, we're really excited about this, and Chrissy touched on this. We plan to launch Messenger and chat on June 1st, and the database will be an online searchable directory of health services across Wisconsin. We've already entered over 3,000 services. We're in the final stage of verifying data. The database will go live around June 1st, and it'll be available to families and professionals. Next slide. Regardless of how a family reaches out to us, via phone, text, or email, the process is the same. And first and foremost, we listen and we offer support. Next slide. These are just a handful of the referrals we make for families of children with special health care needs. Many of the families we work with need multiple referrals. We will work with the family to prioritize or to figure out the next step. Back to Chrissy.
All right, so just a quick note on capacity building. That was asked to put into our presentation, and it was interesting to hear all the other programs as well. So we work pretty closely with these other agencies. I'm talking about the systems level first. I'm doing complementary work. So I think Becky touched on it, and a few others as well, that we tend to do a lot of cross referrals and just really working to make sure that no one falls through the cracks. So we're part of this larger net of services with similar missions or similar types of services. The unique aspect that we bring to the table, in addition to the experience and availability of our team, and being able to talk to a real person, is that we do a lot of our information referral over text and email, and as Chanel mentioned, we'll do chat and Facebook as well. So for families that don't have time to sit on the phone, or they don't like talking on the phone, they can reach out to us in those ways. And then on the family level, we really, as Chanel said, we work hand in hand with families to build confidence and understanding of the services that are out there, the processes for accessing those services, which can be really complicated, working with the families to figure out a step-by-step approach or how to prioritize needs. And then the other really cool thing about what we do is we try to follow up with every family that contacts us, either by text or a phone call or email, and we're able to get real-time feedback on their experiences trying to access those services. So we are able to track any gaps in services, any services that didn't work out so well, and we're able to document that. That can also be a source of change, kind of having our pulse on what's going on across the state. So that's a little bit about capacity building. We can go to the next slide, the final slide here. And this is just an invitation to connect with us. So if you're a family member or you're working with a family that would like to access our services, you can certainly call us. You can text us as well, or email. If you're a provider or a family, you can visit our website. Very shortly, within a couple of weeks, the database will be live and you can search services there. If you're provider or a service provider of any sort, you can also order promotional materials there or join our listserv, or you can check to make sure your agency's services are listed there. And then any other questions you have beyond those two things, you can contact me, and my info is there as well. And that does it for us. So thanks for your time, and please reach out if you need any help.
Okay, thank you, Christy and Chanel. I'd like to ask Sherry then if there are any questions for those two ladies regarding their presentation.
Caroline, yes, there is one question that has come across so far. And the question is, what can a pregnant youth with a disability access through your services?
This is Chrissy. I can respond. It would definitely depend on what the specific needs are of that individual, but that is a great person to call us, because we do try to locate resources for both the pregnancy side of things, healthcare, social services, any programs related to special needs. So that person can definitely contact us, and we'll get their story and work with them kind of hand in hand and figure out what are the priorities.
Great, thank you, Chrissy. And there are no other questions.
Okay, thank you very much, Sherry. And thank you again, Chrissy and Chanel, for presenting. Again, Chrissy and Chanel are part of the Wisconsin Women's Health Foundation. So thank you again for presenting today. Okay, our next presenter is Courtney Salzer. Courtney is the Executive Director at Wisconsin Facets, located in Milwaukee. So we want to thank Courtney for presenting today. And Courtney, you're able to begin when you are ready.
Great, thank you. So good morning, everyone. First off, I want to thank WSPEI for the opportunity to do this, not just on behalf of Facets, but it's personally, it's been really interesting hearing so much about so many of these great organizations. And I think even though I know most of you already, I've learned something new about all of you so far. So thanks again for this opportunity. I'm really excited to be able to share some information about my organization. On this slide, you'll see a picture of the building that we're located within. Our main office is located in Milwaukee, though as you will learn, we serve families, young adults with disabilities, and professionals throughout the entire state. Next slide, please. So a little bit about us. Wisconsin Facets is the federally funded parent training and information center for the state of Wisconsin. And we are part of a national network of parent centers. And what that means is that there is an agency similar to Wisconsin Facets in all of the 50 states and some of the U.S. territories. Some states are fortunate enough to have 2 federally funded parent centers, and Wisconsin is one of those states. So you're going to be hearing from one of my colleagues, Elsa, in just a little bit. But since our founding in 1995, Wisconsin Facets has really had a vision that all children receive the education they need to be successful. And so some of our core values include empowerment, respect, collaboration, quality, opportunities, community, vision, partnership, accountability, dignity, potential, and uniqueness. And we truly believe at Facets that every child has enormous potential and that every family should have the opportunity to play a significant role in their child's education. I want to share with you actually a quote from a parent that we just received in the office this week, because I think hopefully it illustrates a little bit more about what Facets does for families. So this parent wrote to us and said, "I first reached out to Wisconsin Facets many years ago when I submitted a request for evaluation for my son. I had an IEP in place for my daughter, so I doubted that Wisconsin Facets could provide any additional information that I didn't already possess. I cannot believe how wrong I was. Now, whenever anyone mentions that they are considering an IEP, or an update to an IEP, I recommend that they call Wisconsin Facets. Over the years, I've become very well versed in special needs rights in Wisconsin. However, I still reach out to Facets because they are knowledgeable and always give me at least one, but oftentimes many pieces of information that I had not considered or researched yet. I consider Wisconsin Facets one of the special needs community's greatest assets. I am so thankful that I called that first time many years ago. Next slide, please. So again, we were founded almost 25 years ago by a small group of committed parents who had a strong desire to help other families. And when our doors first opened, we had 2 part-time staff, a very tiny office, and served just one community in the state. Since then, Wisconsin Facets has grown greatly. We now have a much larger, diverse staff who serve the entire state through a wide variety of programs, all designed to assist individuals, families, young adults with disabilities, and professionals. Our services are available to parents of children with any type of disability, ages birth through 26. Our services are also available to young adult self-advocates and the professionals and educators who work with children with disabilities. On the screen, you see pictures of each member of our talented staff. We are certainly a small staff, particularly to serve an entire state, but our staff has an amazing variety of skills and education. And we're very proud of the fact that all of our staff are either parents or relatives of individuals with disabilities or persons with disabilities themselves. Next slide, please. Okay, so we were asked to share with you what types of services we provide to families of children or young adults with disabilities. All of the services and supports that Wisconsin Facets has available to families are provided with the goal of empowering families to make informed decisions about what they believe is best for their own child or children. So, really looking at that empowerment piece. Also very important, all of our services to families are provided free of charge. Our 2 primary services really are our training offerings and our help desk. So I'm going to start by just sharing with you a little bit about our trainings. Each year, Wisconsin Facets provides 60 plus training opportunities, and they really cover a wide variety of topics, all related to special education and disability. Last year, we provided training to over 5,000 different individuals. Most of our workshops are done via webinar, and we try to schedule these from 12 to 1 so that they loosely fall over the lunch hour. And we use webinar technology so that families, no matter where they're located in the state, can be able to access our training. All of our webinars are also recorded, so that means that if you do have a scheduling conflict, you can certainly access that recording after the training. If you are interested in more information about the trainings we offer and getting registered for any of those trainings, I've listed the website on the slide where you can go to get that information. I also did just want to point out that Wisconsin Facets is part of a group of agencies who plan annually a conference called Endless Possibilities. This is a one-day conference. It's happening this year on August 2nd. The conference will be located in Whitewater at the University of Wisconsin-Whitewater. And this year's conference is focusing on supporting students with learning disabilities. The registration for this conference did just open. There is a nominal registration fee of $35, and that basically just covers your meals there. And when I'm done with my slides, I will pop the link into the chat box if people would like to go and get more information or get registered for that. In addition to our trainings, I would say our other really core service is that we maintain a help desk where individuals can call a toll-free number to get information, ask questions about their child's special education needs or plans. Last year, our help desk reached more than 3,600 parents, professionals, and young adults. Our help desk specialists are trained to work with callers to problem solve issues, explain rights and processes, and also to brainstorm options. Our help desk is also going to be available to provide a lot of different resources and can also work to connect callers with other entities or other local resources that may be available in their communities. Callers can reach our help desk Monday through Thursday from 8:30 to 4:30, and the toll-free number is listed on the slide. In addition to training and our help desk, Wisconsin Facets also does offer a limited amount of what we would consider intensive support for families. And under the umbrella of intensive support, this may include reviewing a family's IEP with them, preparing families for an upcoming IEP meeting, and we do have a limited availability to also provide in-person support at IEP meetings, facilitated IEP meetings, and mediations. With regards to the in-person support, there's really always a huge demand for this type of support at school meetings, and we certainly understand this, and truly we wish we could accommodate all of the requests that we receive, but because of our limited resources, we do have a criteria that we look at to help us kind of triage the requests we get for support at a meeting. And some of the things that we look at are whether the issue is kind of a systems change issue. So seclusion and restraint is definitely a systems change issue that we're experiencing in our state. So, cases involving seclusion and restraint will get kind of a closer look. We are also looking at and considering whether the child has been out of school for an extended period of time. I think we can all agree that having kids in school is the best place for them, and so cases where a child hasn't been in school for a while certainly are important for us to be able to provide some support in those situations. We also look at whether the issue is being experienced by multiple other families. From time to time, we get calls where there seems to be kind of a pattern happening in a particular, pocket of the state, and so those are the types of issues that if they're being experienced by multiple families, particularly in the same kind of local area, those are the types of meetings that would kind of rise to the top of the list for us to attend. And then we're also looking at the capacity of the parent. If the parent has limited literacy, or if because they experience disability themselves, may also have an inability to really fully understand kind of the process and the proceedings, that's also something we take into consideration. So that's kind of our triage criteria. It's important for me to share with you that Wisconsin Facets does not provide legal services or legal advice, and I know some of the other organizations that you've heard about or will hear about do that, and that's wonderful and certainly important and needed. But at Facets, our role is not, we're not going to provide attorneys, and we also don't provide any type of legal representation. The other thing I just want to mention is that all of our services at Wisconsin Facets that are available for parents are also available for school staff, related service providers, and other professionals. And that's because we believe very strongly that empowering educators with information and resources ultimately benefits the children and families that they're serving. So for that reason, not only can professionals access our services, but our services are also free of charge to professionals as well. Our trainings in particular are quite popular with educators, and I think it's because they provide an easy to access, high quality professional development experience for professionals at no cost to them. Our help desk is also available to educators should they have specific questions or if they're looking for relevant resources. And on any given day, we receive a number of calls from whether it be teachers, administrators, aides, or other types of related service personnel that are looking for some resources or have questions. Facets also publishes a monthly family engagement newsletter, and this newsletter is really chock full of articles, resources, tips, and upcoming events relevant for families and educators. I've put the link on the slide for how you can sign up to get that newsletter. And then last, I would encourage people to visit our Facebook page. We're providing daily posts about upcoming events and trainings. We highlight resources, and we spotlight other agencies or entities that we think would be of interest to the consumers that we serve. We also do, and I apologize, I left the link off the slide, but we also do maintain a Facebook page for Spanish-speaking families, and all of the content provided on that Facebook page is provided in Spanish. Next slide, please. Great. So we were asked to speak to you just briefly about the things that make our agency unique. I think from my perspective, it's really our steadfast commitment to empowerment. We believe that parents are the best experts on their children. And for that reason, we really strive to ensure that we are showing families how to acquire the knowledge and the skills they need to be confident in advocating for their own children's needs. So for that reason, Wisconsin Facets will never make decisions about a child for a family. We are never going to force a consumer down a particular path. We don't even call schools on behalf of families, because it's really our belief that we are there to support and empower parents and families to be able to feel comfortable doing those things themselves. Once our families that we serve are feeling confident and comfortable, we then, with their own child, we then encourage them to consider further developing their leadership skills so that they may be able to impact other families or systems. And so we maintain a cadre of trained volunteer parent leaders who are willing to share their knowledge and experience in their local communities. Often these parent leaders volunteer for us to host exhibit tables at conferences or events in their local communities, or to facilitate support groups. In fact, last year, in partnership with our parent leaders, we were able to have a presence at more than 60 different exhibits throughout the state. And that wouldn't be possible without our volunteer parent leaders. We also offer specialized training throughout the year to cultivate leadership skills for parents. And much of this training, this leadership training, focuses on serving on groups that make decisions, a guide for families. That's a publication that we were the lead in producing several years back, that is intended to really provide information to skill up parents so that they can be meaningfully engaged in various decision-making groups, whether it's at the local level, the county level, or the statewide level, or even the national level. And our hope really is that more and more parents of children with disabilities do eventually find their way onto boards, advisory groups, policy groups, things of that nature, because we truly believe that that's the way that we can best not only pay it forward, but we can also make meaningful systems change by having the families with the lived experience participating in those types of leadership opportunities. So that is all I have.
Okay, thank you very much, Courtney, for presenting. So let's move into the question and answer portion for Courtney. So I'll turn it over to Sherry then to see if there are any questions for Courtney at this point.
Caroline, there is one question for Courtney here that came over. The question is, what kind of training and experience does your staff have with review of IEPs and in facilitating IEPs?
So our help desk staff and our intensive support specialists have, I would say, significant experience reviewing IEPs. In fact, that's a huge component of the job that they do each and every day. Some of our staff have had IEPs themselves, so have kind of that type of lived familiarity. Others of our staff are parents of children with disabilities, and so have experienced the IEP process that way. And we also have former educators on staff who have experienced the process that way. We do not facilitate IEP meetings for schools. That's not our role or our function. When we do attend an IEP meeting in support of a family, we are there not as the family's representative. We are there to ensure that the family is understanding the process, that they are able to express or vocalize the concerns or the priorities that they have, and again, just to be a support person for them through that process. If the question was asking about facilitated IEPs, which is an option through the state's dispute resolution system, we are available to support families in facilitated IEPs. Again, that falls under that in-person support, so we're really kind of having to triage those. But again, our role, even in a facilitated IEP, is not to serve as the facilitator, it's to be there as a support person for the parent.
Great. Thanks, Courtney. And that's it for the questions.
Thank you.
Okay. Thank you, Courtney. And again, you've just heard from Courtney Salzer, the Executive Director at Wisconsin Facets. So thank you again for presenting for us today, Courtney. Joining us now is our next speaker, Deb Romaker. Deb is the Associate Director of Wisconsin Family Ties. So we'd like to thank you, Deb, for presenting today. And again, you can begin when you're ready.
All right, thank you so much. We really appreciate the opportunity to talk about Wisconsin Family Ties with everyone. And as Courtney said, I've been familiar with a lot of your organizations as well, but it was really good to get refreshers on some of you and to learn about new things that I didn't know before. So thank you very much, WSPEI, for putting together this opportunity. Wisconsin Family Ties is a statewide parent-run nonprofit, and we serve families who have children with social, emotional, behavioral, and mental health needs. And we also serve the professionals who work with them. Our population that we serve is birth to about age 26. There's no definite cutoff, but it's kind of young adults who are in transition. We would help their families as well. Next slide, please. Obviously, you guys can probably read this. Our mission is changing lives by improving children's mental health, and our vision is to be the premier provider of information and support for children's mental health. Wisconsin Family Ties has been around for over 30 years now. We began in 1987. It was a group of parents from around the state that were involved in different local support groups, parents who had kids with mental health needs, and they were seeing that there were other groups forming for kids with different kinds of disabilities or different kinds of special needs, but they weren't seeing anything that was specifically targeted toward families that had kids with mental health needs. So in that time, they came together and formed a steering committee, which eventually created Wisconsin Family Ties. In 1988, WFT was one of 5 organizations in the country to be awarded one of the first statewide family network grants, which we still continue to receive to this day. Next slide, please. So our purpose is to improve outcomes for children and families by delivering high-quality parent-peer support, and then also to improve children's mental health policy and practice in Wisconsin. Although we work toward improving children's mental health, we actually work with the adults surrounding the children. So we don't typically do direct work with the kids. Our belief and our experience is that if you change the adults around the kids, the kids change too. So we do a lot of work in helping people shift their perspective about why a child might be behaving in the way they are. We subscribe to Dr. Ross Green's philosophy that children do well if they can, and if they're not doing well, there's something getting in their way. And so our belief and the way we work is to help the adults help the kids get through the barriers that might be getting in their way to not be able to do what they want to do. We have 4 main program areas. Parent Peer Specialist Program, which is our core program at Wisconsin Family Ties. We also do a variety of trainings throughout the state for both professionals and parents. We do workshops and trainings at different conferences throughout the year. We also have our own conference within our trainings, which is the Children Come First Conference, and that happens every November. We also do legislative and policy advocacy, and we have been involved with several different priority areas. One that we also focus a lot on is seclusion and restraint, and we were involved with DRW and Facets in helping create that first initial seclusion and restraint law that is in place, and are also working with them to try to strengthen that seclusion and restraint law a bit. And then finally, we have another program which is called the Warm Hearts Fund. It's a very small fund, but what we do with it is we recognize when we have families referred to us who are struggling with meeting basic needs, that they're really not ready to be able to work on the kids' behaviors and issues, because right now they're concerned about, do we have a house next week? How am I going to put food on the table? And if those basic needs aren't met, they're not super concerned about, is my kid showing up for school every day? They need to meet their family's basic day-to-day survival needs first. So what we do with the Warm Heart Fund is we help families with that stuff. Initially, we would certainly try to help the family to work with the resources in their area, the county, different charitable organizations, etc. If after exhausting all that, there's still a need, then we might tap into the Warm Heart Fund to help the family. Some examples of what we've done with that have been, we had a family that was being evicted out of their house. They had a new house lined up, but there was a 2-week period in between where they had nowhere to live. So we tried a lot of different ways to get funding for this family, and eventually what we ended up doing was our Warm Heart Fund paid for the family to spend 2 weeks in an inexpensive motel between their one house and the other. So they were able to have a place over their heads for those 2 weeks. We've done things like purchase firewood for a family in the wintertime when they don't have heating availability. We don't advertise it as a big piece of what we do because it's not the primary focus of our organization. But again, the primary focus is working with families and helping kids do better. And a family can't really focus their attention on that, like I said, unless basic needs are being met. So that's kind of, we just came to that because that was what was happening. Next slide, please. So the services and supports that we offer to families, we have an intake specialist who we call a connection coordinator, and she takes calls and emails from people that are reaching out to Wisconsin Family Ties for assistance. She is often able to provide them with information and connections to resources, and that may be all they need from us. So Jackie will spend some time talking to the family, learning about what their needs are, what they're trying to find, and we may connect that family to other resources, refer to some of your organizations if it's a better fit for them. So that is like often our initial contact with families. Our parent peer specialists provide direct assistance to families, and that involves multiple areas. We do get a lot of school referrals, and we do a lot of work with school and IEPs, but we do also work with wraparound teams, comprehensive community services, other county programs. Basically what we say is we're kind of a one-stop shop. If a family has a child with a social, emotional, behavioral, or mental health need that comes to us, we meet them where they're at, we find out what they're trying to accomplish, what they're looking for, and then we help them figure out the way to do that. And the diagnosis is not primary for us. We serve families that have kids with developmental disabilities. We serve families that have kids with mental health diagnoses. The primary thing for us is your child struggling with a social, emotional, behavioral, or mental health need? So we do end up working with a lot of families that have kids on the autism spectrum. Many of our staff have kids on the autism spectrum. All of our staff are parents of kids with social, emotional, behavioral, or mental health needs. I think we do attend IEP meetings with families if that's what they need us to do. We help them prepare for IEPs. We go to manifestation determination reviews. I think we are the only organization that sends people with families to expulsion hearings as well. So that is kind of a core of what we do in schools that others I don't think are really doing, is helping families prepare for expulsion and actually going to the expulsion hearings with them if need be. And then in addition to offering parents access to our parent peer specialists, we also have the Children Come First conference. As I mentioned, that is held every year in November. This year it will be November 11th and 12th at the Glacier Canyon in the Dells. Last year we had 840 people attend. We actually had to shut down registration, so that was kind of exciting for us. It's the biggest children's mental health conference in the state. We usually have nationally known keynote speakers, and then we have, depending on the year, 30 to 45 different workshops. So people have the opportunity to, especially for parents, they have an opportunity to connect to each other, to professionals. We have a lot of social workers and educators that attend that conference. So it gives everybody a chance to network and learn from one another. Next slide, please. And then, as I mentioned, these are some of the services and supports that we directly provide with schools, assisting and attending IEP meetings. And that is a support for parents, but it's also turned out to be a support for schools. Many times we've been told by the school staff after we've been at a meeting, that's the best meeting we've ever had with that family. And we kind of joke that oftentimes it might just be us sitting at the table. We don't even really have to say anything. It's just having another person there that understands both sides of the picture can really help both the parent and the school staff feel supported. We have schools routinely calling us to help out with IEP meetings or to assist them with families that they're struggling with. In fact, we're contracted with several school districts to help. So we don't work for the school districts. That's a big thing for us, or the counties. Those are where our contracts come from. But we want parents to understand that we're not affiliated with the school. We're not affiliated with the county. Our role is to help the parent. So we're not school employees. We're not county employees. But ultimately, our goal is to help families and providers develop a collaborative relationship. So that bottom line is what we look for, and we often are able to accomplish that. We do also we also help provide engagement strategies. We have a family engagement model that we call the Wisconsin Plan, and we also provide trainings on family and parent perspective. We work with families to help them understand the teacher administrative perspective as well. So we really try to help both parties understand each other's perspective. Next slide, please. And as I mentioned, as you heard, they asked us to talk about our unique services. For us, Peer Specialist Program is as I said, it's kind of our core service, and it's unique in that we have been doing it for 30 years, and we directly work with the families throughout Wisconsin. And I see that I'm getting to the end of my time, so if there's any questions, please let me know, and thank you again for the opportunity to speak today.
Okay, thank you, Deb. We really appreciate your time presenting today. So I will turn it over to Sherry to see if there are any questions for you at this time.
Yeah, I do have some questions here. So first question, does your organization attend all meetings that they are requested for, or do they have some sort of criteria for deciding which meetings to attend?
We used to be able to work with any family that gave us a call. What we have found with the different funding that counties are doing in terms of comprehensive community services, we have had to limit some of the services that we've been providing by putting families on a wait list. We do have crisis if families in crisis, meaning if they have a kid facing expulsion, if their child is facing out-of-home placement, if they're coming back in from out-of-home placement, those families would get priority and they would not be put on a waiting list. Other than that, if they've been able to be either funded through the districts that we contract with or funded through the counties, any meeting they'd want us to go with them to, we would go to. We really are driven by the parents' needs.
Great, good. I have another question. If you could, again, share the date of the Children Come First conference.
Sure, it's November 11th and 12th. And we do have a website for the conference. It's ccfconference.org.
Great, okay. Another question, during IEP meetings, do you provide ideas and suggestions to school staff and families in developing IEP goals and behavior intervention plans?
Yes. Short answer is yes.
That's good.
We were
all right.
the family ahead of time, but yes, we do.
Okay. And then one more question. Do your peer specialists go through the certified state training program for parent peer specialists?
They are currently, and actually 4 of our staff are trainers of that curriculum. The certification for parent peer specialists just was rolled out last fall, and the first exam for certification was in January. So several of our staff are certified already, and as I mentioned, 4 of them are trainers of the curriculum. So we don't require our parent peer specialists to go through the certification training because frankly, our training is much more advanced than what the certification is. For example, the certification requires 48 hours of this curriculum. Our staff get 168 hours of training in the first year, at 88 every year after. So we are involved with it, but we don't require it for our staff.
Okay, great. Thanks, Deb. And that's it then for our questions.
Thank you.
Thank you, Sherry. And again, you've just heard from Deb Ramaker. She is the Associate Director at Wisconsin Family Ties. So again, thank you very much, Deb, for presenting today. Our next speaker and/or presenter is Elsa. And Elsa, you're going to have to pronounce your last name for me because I am not sure and I don't want to mispronounce it. Elsa is the Executive Director at ALICE in Milwaukee. So again, thank you, Elsa, for presenting and participating today. And if you can reintroduce yourself with your full name, that would be great. So you can begin when you're ready.
Well, my full name is Elsa Diaz Bautista, but I am perfectly okay with being first name basis. Elsa is fine. It has become a very popular name in the last couple of years, so Elsa is just fine. So yes, I have the honor to serve as the Executive Director of ALICE. And next slide, please. ALICE is a family resource center located in the south side of Milwaukee. Next slide, please. We serve families with children, youth, and adults with disabilities. And as Courtney mentioned, we are the second federal funded institution here in the state of Wisconsin, but we are short with serving specifically the Latino community in the Milwaukee area. Next slide, please. We started with a group of Spanish-speaking families that were struggling with figuring out how to navigate the available service to be able to serve their children with disabilities back in 1997. So we are over 20 years old, and yes, we started by Spanish-speaking families. Those we are serving the Latino community. Next slide. Yes, you know, we after 1997, we have become a nonprofit organization, and we're serving thousands of families here in Wisconsin, even though we only are charged to provide services for Latino, Spanish-speaking community in Milwaukee, we end up receiving referrals from surrounding areas throughout the state, and we go ahead and serve those. And we also stretch our services to English speakers. Next slide. Our mission is, they asked us to put our mission up. So our mission, as you can see, is to promote the independence of people with diverse ability by providing information not only on education, but also on health, and not limited to that. But we serve the families, the service providers, and whoever is associated with helping the family with their children with disabilities. Next slide, please. Our vision is for people with disability to be able to reach a state in which they can live full lives as defined by everybody that, you know, enjoy everything in life. And we try to accomplish that by, you know, by creating a positive impact in their lives. Next. So our services, we're going to go through a couple of our services, a list of our services slide by slide, because we love pictures. We like showing our family. So the first service that we do is advocacy, you know, trying to talk to the parents about how to build collaborative relationships within the school and home, you know, training them on the adequate use of language when they're promoting, you know, services or asking for services. Next slide. We also provide information and referrals. So we think that if a family calls us or walks in with a question that we don't have the answer to, we'll look for them and then refer them to those services. And then again, we are partnered to almost every single one of the organizations that has spoke today about their services. So if there's something they're offering that we're not experts of, we referred those families to them. And if there's a Spanish-speaking family, we stay in the loop to help with the language needs. Next slide. We are charged to serve the families with people with disabilities. But since I came on board, we recognize that the whole family as a circle, when everybody receives services and supports, that the outcomes are better. So now we are providing self-determination and self-advocacy to our young adults, our young self-advocates within our families. And since we're 20 years old, now many of those started with the beginning of the organization, and now they're young adults being peers to the younger adults. So that's one of the things that we're beginning to do. Next one. This is the main thing that we do, is provide family educational training workshops on any issue that the family wanting to learn some more about. And we do that through looking for experts in the field throughout our region and bringing them on site to talk to the families and train them. And if they need interpretation services for the family to receive that information, we provide that in-house. Next. We recognize that our families struggle throughout the summer months because most of the children are not receiving extended school services. So we try to figure out ways in we can keep the family engaged with their children throughout the summer. So we try to come up with summer activities that are intentionally designed to involve and keep our young people with disabilities busy throughout the summer. Next. We have another core service that we provide, and it's our family support groups, in which our families come in every month and they get together and talk about different topics. Sometimes we set up the topics we survey them to see what they're looking for, and then we provide a way for them to ask questions, and we'll have answers for them ready during the support group. And sometimes they just want to talk to one another and learn from one another about what works and what other families are trying in similar circumstances. And this is a great, very popular one of our services that we have currently. Next. We cannot do our work. We're a staff of 3 serving hundreds of families. Right now we have actively over 500 families, so we couldn't do it without our volunteers. So we provide a lot of training and volunteer opportunities for the young people attending college. So that's something that we have currently. We take full advantage, and we're really proud to know the more exposure that we have of people in the community working with people with disabilities, the better chances that our kids and our families will be able to be in a inclusive community. Next. We attend a lot of resource fairs, and we promote resource fairs, and we really believe that it's more than one village to get all this work done. So we make sure that the families attend resource fairs throughout our community so that they can learn about services that are available and supports that are available to them. And we attend many of those to make sure that we let other people know who we are and what we have available to them. Next. We have had the opportunity to partner with other people to offer some summer camps and activities. We have had our self-advocates come and do a community garden throughout the summer. We participate on Miracle League throughout the summer, and we have attended a couple of camps. So that's another way that we can try to figure out how to help the families throughout the summer months. Next. We partner with the school district, specifically MPS, and currently we're offering 2 annual family special education forums. One is in the spring that is called Celebrating Abilities, and one is in the fall that has been offered for the last 17 years, and that's Photo Latino, in which we partner with a lot of organizations to have a resource fair, and we schedule workshops with experts in the field on different topics like IEP preparation, transition topics, community services, and all of those in the special education forums throughout the year. So that's how we partner with the schools and the teachers to make sure that we can provide services and resources to our families. Next. We lately have had the opportunity to have some of our young self-advocates come to our office and experience a little bit of work. So employment training, shredding, helping us organize files and, help tell a story to other children, help on childcare services that we provide when the families are attending workshops. So we're really, really proud. That's in a volunteer basis and as needed in the office, but we're really proud that we have had the opportunity to serve in this capacity, to provide some unofficial employment training to our self-advocates. Next. We also partner with many organizations throughout the state to be able to make available and accessible to our families. They attend for them to attend conferences and statewide events. We just took 16 families to the Circus of Life conference, and last year we took about 6 self-advocates to the self-determination conference. Our families also participate on the Disability Advocacy Day every March in Madison, and we partner with other people to make sure that this is available, accessible, and possible for our families. Next. We have a good database of parent-to-parent support that we have developed. And like Robin was explaining before, you know, parent-to-parent is one parent helping another parent in a similar circumstances, and it's not necessarily related to healthcare needs, even though that's the majority of the request. But like one time we had a parent that wanted to try homeschooling, and they wanted to be matched with the parent that was homeschooling their child so that they can figure out, you know, what works, what doesn't work, so things like that. We definitely have a lot of parent support, and it's one of the trainings that we use to empower our parents to be leaders to one another. Next. Of course, it's without saying that we provide interpretation and translation based on the nature of our work and the nature of the population that we serve. Being a 98% serving the Latino community, language is one of the barriers within their accessing resources and services in the community. So we do a lot of interpretation and translation services for our families. Next. We try to build a huge community. So celebrating cultural events is something very important. Our families talk about, they feel like ALAS is just a big, huge family that is composed of 500 different families. So we do have, you know, the Three Wise Men in January celebration, the Children's Day. We sometimes celebrate Mother's Day with our families. We definitely have a back to school picnic / carnival event, and we have an end of the year celebration event to our families. So it's more than just educational and stuff like that. We do fun stuff with the families too. Next. Here's our website, so you can find information for us here at the website. Next. Here, thank you, Caroline, for updating this. Here's our Facebook page. And this, we have changed the name from Alianza Latina Aplicante Soluciones, which is a big, huge mouthful, to just ALAS to make it more accessible to everybody, but that's our Facebook page. Next, here's our Twitter account, in case you want to keep up with our tweet. We are located on the 1615 South 22nd Street, right there in Milwaukee. There is our phone number. Oh, I'm sorry, Ness. Yeah, there it is. Okay, and there is our phone number, and we're located right down on the south side of Milwaukee, Ness. It is important to point out that our hours of operations are Monday through Friday, just from 9 to 3 in the office. But if we, you know, we have many families that are working families that need to see us and visit with us outside of those working hours. So we definitely set up those by appointment, and we stayed in the office to serve them whenever they need to come. Next. I think that's all for me. Did I stay within the time?
Yes, thank you very much, Elsa. And I'll just turn it over again to Sherry to see if there are any questions for Elsa.
Hi there, Caroline, and there are no questions in the chat box. So thanks, Elsa.
Okay,
You're
so
welcome.
again, thank you, Elsa. So again, we've just heard from Elsa. She is the Executive Director at ALAS in Milwaukee. So thank you again, Elsa. And now if you'll bear with me, I just need to bring up our next presentation from Lisa Pugh. And she is the the State Director for the ARC Wisconsin. She recorded her presentation earlier. So if you just give me a minute here, I will bring it up and we'll watch that next. Okay, so here we go. Hello, everyone.
Caroline, we are not hearing anything.
So I give you a little bit of, sorry, let me try again. Okay, I'm sorry. I don't know why. We tried this earlier to make sure it worked. So let's move on to WSPEI, and I will take a look at this, and we'll troubleshoot this for the end of our webinar presentations.
Okay.
So if Amy and Tim are
All right, I'm trying to unmute them, but all right, there we go.
Carolyn's got a because I'm totally muted all over the place. Otherwise, just it's whatever Carolyn.
Caroline, we didn't hear any of your introduction.
Oh, can you hear me now?
Oh, you were muted.
I'm so
See that?
Okay.
Yep, now.
I'm sorry. So again, we have Tim Baroud and Amy Elsmer from the WSPEI, the Wisconsin Statewide Parent Educator Initiative, to present next. So Tim and Amy, whenever you're ready, you can begin. Thank you.
All right. So, so this will be an overview of the Wisconsin Statewide Parent Educator Initiative. Most people refer to us as WSPEI. My name is Tim Baroud, and I'm the WSPEI Family Engagement Coordinator for the CISA 6 region. Amy Elfner, a CISA 1 Family Engagement Coordinator, and I will be sharing with you for the next few minutes. Next slide. So the Wisconsin Statewide Parent Educator Initiative, or WSPEI, is a discretionary grant funded through the Wisconsin Department of Public Instruction. Because it's a discretionary grant, all services provided by WSPEI coordinators are free of charge. Since its inception in the year 2000, WSPEI's goal has been to support and encourage engagement between the schools and families of children with individual education plans, or IEPs. So we do this by providing information and resources around special education and also the family's role in the IEP process. Each of the 12 CESA regions throughout Wisconsin has a WSPEI Family Engagement Coordinator, and coordinators themselves are parents of a child with a disability, which gives them a unique perspective when helping families. Next slide, please. So WSPEI's vision is that all families and school communities have the beliefs, knowledge, and skills to meaningfully engage in effective decision-making to improve outcomes for students of all abilities. And our mission is develop strong relationships, build effective partnerships. Next slide, please. WSPEI works to support and empower families to be more engaged in their children's education and in the decision-making process. So some of the services we provide to families include preparing parents to be equal partners in the IEP process, and also providing support, information, and resources. We connect families to community agencies that provide supports for them and their children, and we also offer parent education workshops, conferences, and other learning opportunities. WSPEI is all about collaboration between families, youth, and educators. Therefore, WSPEI coordinators are unable to attend an IEP meeting in an advocacy role. But coordinators can help families and provide support throughout the IEP process. Next slide, please. WSPEI can provide families with resources that enhance communication and encourage building relationships with their child's education team. Special education resources can be found on the WSPEI website, which is www.wispei.org. And 3 examples for families include a communication options for families form, which lists contact information for school personnel and others that can answer your questions and also provide options if you disagree with the decision of the school. A second is the student snapshot, which was developed as a way for families to provide their perspective and information about their child at the IEP team meeting. And third is the My Snapshot form, which actually helps students share information about themselves with school staff. Next slide. And at this point, I will turn it over to Amy.
Hi, thanks, Tim. Can everyone hear me? Yeah, okay.
Yes.
Okay, great. So in addition to the services Tim already mentioned, 2 opportunities WSPEI provides for family and student learning are Parents in Partnership and Youth in Partnership with Parents for Empowerment. These are also known as PIPs and YIPPIs. PIP is a statewide program in which a group of parents and other caregivers meet together 5 times during the year to share their family stories, challenges, joys, and triumphs of raising their children. At PIP, participants will learn about the community and statewide resources available for children with disabilities. Those who are eligible to attend are parents, foster parents, or grandparents who have children with disabilities aged 6 to 14 years old for a traditional PIP training, or aged 14 to 21 for a transition-focused PIP. These children must be receiving special education services, and families must be able to attend all 5 weekends. YIPPI trainings are for a group of youth and their parents who meet together 5 times during the year as well. They will hear from speakers and take part in hands-on activities in parallel programs centered around transition and self-advocacy. While some topics may overlap, parents will be able to enjoy their own sessions with their youth while their youth are learning similar information in a youth-friendly format. Those who are eligible to attend a YIPPI workshop series are youth ages 15 to 20 who are receiving special education services and their parents, foster parents, or grandparents. Space for both PIP and YIPPI trainings is limited to 25 parents. For specific information on upcoming trainings for the 2019-2020 school year can be found on the WSPEI.org website under the Education and Training tab. Next slide, please. If families have questions about special education or the IEP process, they are encouraged to call the WSPEI statewide phone support line at 833-879-7734. Families are encouraged to leave a voicemail if a coordinator is not available at the time that they call. Or if preferred, questions can be emailed to WSPEI@CESA12.org. That's WPSEI@CESA12.org. Their message will be replied to in an email format. Family engagement coordinators who are staffing this phone support line are available to answer questions about special education and provide information about the IEP process. They will also share relevant resources and provide referrals to address the concerns of the family. Next slide, please. In addition to supporting families, WSPEI can also provide resources, referrals, and information to school staff. We can help educators engage with families in conversations about their child's educational experience. We support the recruitment and identification of district family engagement liaisons. A district family engagement liaison is a district parent of a child with a disability who is chosen by the special education director. This parent receives training through the WSPEI grant on special education topics, ways that families can partner with their school district, and about positive school-family communications. WSPEI can also help educators access materials to support more effective collaboration and on how to build trusting relationships with families. When requested by a district, WSPEI coordinators can also provide trainings for educators and district staff related to family engagement. Next slide, please. WSPEI Family Engagement Coordinators can also offer support and guidance to school district teams in family engagement, assessment, and planning. This planning process will gather and examine school district data on family engagement practices, explore educator beliefs around working with families in the education of their child, and could lead to the implementation of a family engagement plan that improves school and family relationships and can result in better outcomes for children with IEPs. As mentioned earlier by Tim, all resources, trainings, and supports for families and educators are free of charge from the WSPEI grant. Next slide, please. Today's presentation has been a quick sampling of what WSPEI can provide to families and educators. If you would like more information on any of the family engagement services and supports shared with you today, please contact your WSPEI Family Engagement Coordinator in your CESA area. This can be found on the WSPEI website, wspei.org/contact. You may also reach out to our grant director, Rita Fuller, at rita.fuller@dpi.wi.gov, or our WSPEI grant coordinator, Caroline Rossing. Thank you. That's it.
Okay, so let's move into any questions that we have for WSPEI, for Tim or Amy at this time. So Sherry, do we have any questions in the chat?
Caroline, there are no questions at this time.
Okay, thank you. And again, you just heard from Tim Baroud, CESA 6 WSPEI coordinator, and Amy Elfner, one of the CESA 1 WSPEI coordinators, and they were presenting about in regards to the Wisconsin Statewide Parent Educator Initiative. So again, thank you, Tim and Amy, for presenting today. I want to move into the last slide, and I want to say thank you to everyone, but I still want to go back and try to get Lisa Pugh's recorded presentation going so you can watch that. But before I do that, I want to thank you again for attending. We hope the information in this webinar is beneficial to you. And please watch for an evaluation in your email regarding the webinar. I believe we'll also include in that
email with evaluation contact information for each of the agencies so we can put it together nicely in a document for you. So thank you again, and if you can stay on with us a little bit longer, I'm going to try to get up Lisa Pugh's presentation from the ARC Wisconsin. Okay, I'm going to give it a try. I apologize. I don't know why you wouldn't be able to hear the sound, but let's try it again, and hopefully you will be able to hear it.
Hey, Caroline, hang on one second.
That was a little blooper there, so here we go.
Hello, everyone. Glad to be joining you. And
are you able to hear it? Are you able to hear me?
Yes, and we did hear it start.
Okay, I will let it play then. It is about 11 minutes long, so we'll go ahead with it. Thank you.
The opportunity to tell you more about the ARC Wisconsin and the resources we can provide and how you might use us in your work or in your daily life. My name is Lisa Pugh. I'm the Executive Director of the ARC Wisconsin. I've been an advocate for many, many years, and I'm also a parent to a child with a disability. So that gives you a little bit of framework of what I'm about. The ARC was an organization started by family members who were really pioneers of the public policies that you see now that support people with disabilities and their family members. So federal policies like IDEA, Medicaid, Social Security, the Americans with Disabilities Act, really a lot of the roots for those policies came from family members who started ARC chapters across the country. So on the bottom right-hand side of your screen, you see kind of a depressing picture. That's what used to happen to families and children, of course, when doctors told them that the only place for them was institutions. So pioneer families from chapters of the ARC said, no, we want our children attending our local schools. We want recreation and other supports for our children with disabilities. And that's really how a lot of those supports came into place as families fighting for public policies, and that is really the roots of the modern ARC today. Here's kind of an illustration of our success and influence in Washington, D.C. As pictured here, you see President Kennedy signing the Developmental Disabilities Act surrounded by family members and members of the ARC chapters from across the country, up until today, where you see on the right-hand side our public policy director, Marty Ford, sitting alongside the U.S. Attorney General and President Obama, talking about Social Security. And a more modern vision of our movement actually now includes self-advocates, people with disabilities joining the movement, advocating right alongside family members. So in Wisconsin, we have 15 local chapters. The stars on your screen show kind of where those are located. We are part of a network, like I mentioned, about 650 chapters across the country, reaching an estimated 1 million people. So there are a lot of volunteers, a lot of board members, And each chapter of the ARC really looks a little bit different depending on where you live. So in Wisconsin, as I mentioned, I have 15 local chapters, and they're doing a variety of really awesome things. So some pictures on your screen show a sampling. The ARC has a great program called Wings for All, or Wings for Autism, where we work with local airports and help folks to decrease their anxiety and stress about traveling. And so the picture that you see is at the Dane County, or at the Appleton Airport. Dane County also runs a Wings for All program, and Eau Claire will be doing that soon. So you can check out our website and find out more information about that. On the right-hand side, you see our Health and Fitness for All program that really is looking into the health risks for people with intellectual and developmental disabilities and ways to build healthy habits. It's an evidence-based program that's available through our chapters across the country, and we have materials available on that. This is really our work in public policy, which again grounds the origins of the ARC, grounds a lot of what we do in Wisconsin. You see folks in Eau Claire there who just participated in a budget training. So we do lots of trainings and supports for families and self-advocates across a variety of issues, including public education, special education, transportation, mental health support, Medicaid, and Social Security. So if you think about the ARC, think about our emphasis on public policy and system change. How can we support leaders in our community to understand how they can influence the system? So the goals for the ARC Wisconsin, as I mentioned, influencing public policy. You'll hear me say that over and over. We want to raise awareness about people with intellectual developmental disabilities, their needs, their families' needs, be a voice for those folks, particularly inside the Capitol, and then to expand our membership. Need a local chapter of the ARC in your community, that's a great reason to contact me. As I mentioned, we do a lot to support self-advocates and to amplify their voice. Here's just a sampling and some pictures of ways that the ARC Wisconsin has supported self-advocates to advance employment policies within the state, to talk about Social Security and other important federal policies. You see Congressman Paul Ryan in the photo there, and we're spending a lot of time in the Capitol working on things like ABLE account legislation and, like I mentioned, employment legislation. So you can sign up for our updates to really understand what we're working on, and if you think a leadership training or opportunity is right for you or your group, that's a great reason to reach out to me. I mentioned ABLE, and this is the sampling of an issue that we have been leading on with the ARC Wisconsin, a little 101 on ABLE. ABLE is part of federal legislation. It's a way for people with disabilities and their family members on their behalf to save money for disability-related expenses. So it's a really great way for folks to put money away that won't impact their Medicaid eligibility, and in most circumstances won't reduce their SSI payments. But the problem in Wisconsin is we don't have an ABLE program, and we need more information about ABLE. So we're working on some public policy changes. If you go to my website, you'll find out more information on ABLE and have some kind of easy descriptions of it. And you'll see here on this slide that I do direct people to the ABLE National Resource Center, which is www.ablenrc.org. That gives people the opportunity to compare, to really understand the basics of ABLE, but then also to compare programs and determine how they want to sign up. Another issue that we've been really working hard on is supported decision-making. You may have heard that in Wisconsin, we passed the supported decision-making law last year. This is very exciting news. You'll find more information on supported decision-making on our website. Basically, supported decision-making is a flexible alternative to guardianship. So we know that for a lot of youth with disabilities, when they turn 18, the conversation leads to adulthood, and should parents seek guardianship? I think now, because we have a supported decision-making law, the answer is, I don't know, let's get more information. So I would urge you to look at our website, find out more about supported decision-making, check out the new form from the Department of Health Services and think about if that's the right option for you or your loved one. Even if you actually are under guardianship, there are still ways to promote supported decision making. So we're trying to get the word out about that, working with our friends at DPDD. So again, I urge you to look for our webinar materials and other expert resources that are available on our website on supported decision making. Another really important resource that we like to promote through our website is something that you really won't find anywhere else. So a little bit about what is future planning and why is it necessary is that in Wisconsin, a great majority of people with intellectual and developmental disabilities live with their families. In fact, it's about 60%. And when you look at how we're getting older in Wisconsin, about a quarter of those persons with IDD are living with folks who are over age 60. And I know as I travel across the state, I see a lot of 80-year-old moms and dads who have adult sons and daughters living with them. And we don't want those folks to go into crisis. So that's where future planning comes in. We want to make sure that people are having those conversations about what does the future look like? Where do I live after I'm not living with mom and dad anymore? How can mom and dad do more than just kind of setting up the finances of the situation to make sure my quality of life continues after I'm no longer around anymore to do those cares? So what you'll find on the ARC of the United States website are some evidence-based future planning resources. We've worked very closely with family members and self-advocates to develop what's called the Center for Future Planning. There is an actual Build Your Plan tool that really walks you through that future planning process. So I urge you to go to that Center for Future Planning website, and there's just a really easy email and phone number to connect directly with future planners at what resources might be available to you. And then also through the ARC Wisconsin, I've trained a series of professionals who actually have learned how to use these resources. And again, all of this information is available on my website, which is www.arcwi.org. Last but again not least is our great work in public policy. I am personally in the Capitol in Madison quite frequently, also out in Washington, D.C. We have folks who, siblings and persons with disabilities, family members, and professional lobbyists who are working in Congress on behalf of all sorts of public policy issues. So we'd like to consider ourselves experts on public policy and systems change and leadership development for family members and self-advocates so that they can learn the process of how policies are made, how they can be improved or corrected, and sometimes how they can be opposed or, defeated if it's a bad public policy proposal. Stay informed about all the great things I've just talked to you about that come from the ARC Wisconsin. Feel free to sign up for my information. So probably the easiest way to do this is to send a text to 22828. So right in your screen, it says if you text all one word to the number 22828, you will be automatically set for my alert. Of course, you can also go to my website, again, www.arcwi.org, and that will have a sign-up form available right on that front page. That gets you signed up for all my alerts. You'll learn about my trainings. You'll learn about new resources. Sometimes we have grant projects available for people, small projects, and living with our local chapters. So here is the basics of my contact information. Again, you can always call me at 608-422-4250 or look me up through the website, and I hope you'll check out our resources and use us as we can be helpful. Thank you.
Okay. And again, that was Lisa Pugh from the ARC Wisconsin, and I want to thank Lisa for pre-recording that for us today. Also want to thank everyone again who participated in the webinar. Thank you for your time to present. We do have it all recorded. We will make it available to everyone. And again, watch for that evaluation and additional information that we'll be sending you in an email from WSPEI Statewide. So with that, we'll close the webinar. If there's anyone that wants to stay on, has a couple questions, the WSPEI staff will be on for just a couple minutes. So if you have any questions, please ask. Otherwise, thank you again.